Hi everyone, and welcome back to the KG Pharma channel. My name is Simon Kraus.
And my name is Ingo Cross.
Today we're discussing a hot topic from a perspective of a European pharmaceutical machine distributor. What happens if a Trump administration imposes tariffs on medicines from Europe? Let's dive right in. If the US imposes tariffs on medicines coming from Europe, what would be the short-term impact?
Well, first of all, the cost of medications for American patients would spike almost instantly. Hospitals, pharmacies, and health systems rely heavily on imported medications, from cancer drugs to antibiotics. About 80% of generics are imported, mostly from India and China. Since many years, these countries have also built up large production capacities and supply most of the APIs. There is no immediate way to replace these imports with US alternatives. The result? Patients end up paying more, or worse, facing shortages.
The Trump administration says tariffs could be a strategy to bring pharmaceutical manufacturing back to the US. Is it realistic?
Frankly, no. It's an oversimplification. Over 80% of the pharmaceutical manufacturing equipment, like tablet presses, capsule fillers, coating systems, you name it, comes from Europe or Asia. If tariffs hit those machines too, how's that supposed to help? Even spare parts would become more expensive, and specialists would still need to fly in to service the equipment. In such a climate, who would step up to maintain the critical infrastructure? So, any attempt to rebuild manufacturing locally would face skyrocketing costs before even producing a single pill.
How long will it actually take to re-establish pharmaceutical production infrastructure in the US?
You're looking at years. First, you need to build or expand existing factories compliant with FDA standards, then develop and validate new supply chains. You have to train a new generation of pharmaceutical engineers, technicians, and operators, and that's not a fast process. In the meantime, patients would face higher prices, potential shortages, and less access to critical medications. Tariffs won't change the economic situation in the United States. They will just create new and bigger problems.
So, in short, tariffs would make medication more expensive, not magically rebuild US pharmaceutical manufacturing. Thanks again for these powerful insights. If you found this discussion valuable, don't forget to like, subscribe, and let us know your thoughts in the comments below. See you next time.